I was born in Coimbra, in the mainland. Um, I have my background is on electronics and telecommunication. I've been working in a couple of different things. I would say the two main projects are connected to renewable energy, one of them, and the other one connected to sleep. So on the renewable energy part, we have been mostly focused on predicting the amount of energy that is generated, mostly on solar, but also on wind. And lately we moved slightly to analyze the failures and soiling effect on PV systems, meaning that we want to be able to predict when the system is not producing as much as it could produce, so that we can help the companies doing kind of preventive maintenance and replacing the models that are not working 100%. So this of course brings us to companies and to opportunities of doing joint work. On the other hand, on the sleep side, we started out trying to analyze sleep apnea problems. They are very frequent in the populations, mostly in the male population, but we have an incidence of around 10% of people that have this problem. It's the detail that people usually see is the fact that someone with apnea snores, but the effects can be quite large and they have a large financial impact also, because people that don't sleep properly, they don't work properly, they are prone to have accidents like driving accidents. So we're working on analyzing sleep apnea and sleep quality in general, and our objective is to build a light, small, inexpensive device that is able to detect the events of sleep apnea, detect or analyze the sleep quality, and to give feedback not only to the patient itself but to the physicians, so that they can be aware in which situations they are more exposed to risk because they actually didn't sleep well, and also not to overload so much the health system and to a little bit overpass the high costs of analyzing this type of disease.
Okay, so before, when I was mentioning the project about sleep, and I mentioned sleep apnea and sleep quality monitoring, this is what we do. This image is from the prototype that we want to create. We're applying for more funding, so we want to monitor the patients using, well, the simplest device with the lower number of connections that we can. Currently, the standard is polysomnography, which requires at least 7 connections, and they do disturb the sleep of the patient a lot. So we want to make something very small, based on a pulse oximeter like the one Fabio is holding, and this registers only the oxygen level, and we want to process it with a small device. So the FPGA that Fabio is holding now, this is a big one. We actually wanted to make it as small as a big watch, and to do the analysis of sleep with only one signal, it requires a lot of processing. So what Mustafa is doing currently with this PC is processing the signal with deep learning. So deep learning neural networks requires really heavy processing. That's why we have 2 computers here with GPU units, so that we can extract different features, and we can, with these features, replace a lot of different sensors. And currently we achieved results that are in the same range of values that we can find as agreement between two different technicians analyzing the sleep signals. Okay, so I think this is mostly what we've been trying to do in order to make the detection of sleep problems cheaper and faster, because currently health systems are overloaded with the number of patients they need to test, and the tests are also quite expensive.